This is part 1 of OPWDD's Prevention of Choking and Aspiration. The Office for People with Developmental Disabilities recognizes that individuals with developmental disabilities present a high risk for dysphagia, difficulty swallowing, which can lead to both choking and aspiration. This online course reviews preventative measures to decrease the risk of choking and aspiration. Course expectations. In this course, you will review the following: definitions of choking and aspiration, common issues that people with developmental disabilities face when eating or drinking, identification and reduction of hazards through observation of the person and their environment, interventions to reduce the risk of choking and aspiration, appropriate first aid responses to an incident. Definitions. Choking. Choking is the blocking of the airway by foods, liquids, or foreign objects. Definitions. Aspiration. Aspiration is the inhaling of foods, liquids, or foreign objects into the lungs. This is also known as going down the wrong pipe. Common issues. For people with developmental disabilities, common issues exist that place a person at risk for choking and aspiration. The person has decreased muscle coordination and/or tone, which is causing problems with their chewing or swallowing. The person has difficulty holding their head up or sitting up straight. The person has impaired mobility, which leaves them unable to properly position themselves for adequate swallowing. The person has been diagnosed with gastroesophageal reflux disease, commonly referred to as GERD or acid reflux. The person has dental concerns or problems. The person takes medications that affect the muscles of the throat or mouth and cause delayed swallowing. The person has poor self-eating skills and is prone to food stuffing or rapid eating. The person has difficulty swallowing anything with inappropriate fluid or food consistencies. The person is assigned a staff team member who has not been trained in supporting people with their eating/drinking. Prevention is critical. Some incidents are completely preventable. Mealtime can be pleasurable for some and a difficult time for others. If we identify problems and develop interventions early, we can ensure the health and safety of individuals and make eating and drinking a pleasant experience. Your challenge. The greatest error made by most treatment teams is failing to identify the source of the real eating or drinking problems. Treatment teams should routinely consider a wide range of potential causes. Intervention and prevention strategies should be identified and noted in the ISP, CFA, any risk assessments, and dining plans. How a person eats should be discussed during the interdisciplinary service planning session, and if risks are present, a good plan of prevention should be discussed, written down, and shared with all staff that support the individual, including day program staff. Observation. Observation is the greatest incident prevention tool you have. When helping an individual eat or drink, make sure your attention and focus stays on the individual. What to observe? Does someone else put food or fluid into the person's mouth? Does this person cough or choke during or after finishing their food or beverage? Does food fall or fluid drool out of this person's mouth? Does this person regularly refuse liquids? Answer yes if, for example, they will not drink for certain staff, or if they like drinks that are only thick or only thin. Does this person regularly refuse food? Answer yes if, for example, they will not eat for certain staff or they do not like certain consistencies. Important. If an individual's eating or drinking pattern changes, please notify the nurse or supervisor immediately. Does this person have a medical condition such as cerebral palsy, acid reflux, difficulty swallowing, or hiatal hernia? Does this person have chronic chest congestion, frequent pneumonia, rattling when breathing, persistent cough, or does this person chronically use cough or asthma medication? Does this person complain of chest pain or heartburn or have small, frequent vomiting, especially after meals, or frequent or wet burping? Does this person eat or drink too rapidly or stuff food into their mouth that may cause choking? Does this person have extreme food-seeking or liquid-seeking behavior that may cause injury to them? Does this person engage in pica behavior? Some persons with developmental disabilities have a condition called pica that causes them to eat non-edible items such as rubber gloves, batteries, cigarette butts, or paper. It is important to pay close attention to the environment of the home if there is an individual with pica living there. Interventions are methods to help reduce the risk of choking and aspiration. Know the individual's written dining plan. Prepare the appropriate food texture and liquid consistency per physician's order. Only trained staff are to assist with eating. If there are swallowing difficulties, consult with a nurse or supervisor immediately. Carefully stop the individual from eating if the person coughs, chokes, or gags. Call for help and apply first aid if needed to ensure the safety of the individual. Maintain a slow pace of eating and decrease the size of bites. Be sure individual is seated for meals and snacks in proper sitting position to encourage safe swallowing. Do not engage in power struggles with persons that have behavioral issues when eating. Maintain a calm environment while eating and drinking. Supervision. Supervision is critical for choking prevention. Supervise all individuals when they are eating and or drinking at meals, snack time, medication administration, in program, or in the community. Movies, picnics, ball games, restaurants. Training protocols. Staff should be trained in prescribed food and liquid consistencies. If there is any possibility a person is choking, do not wait. Call 911 or activate the emergency medical services and assist the individual immediately by applying choking interventions per your first aid training. If a person is assigned to one-to-one staffing, staff must follow the one-to-one protocol. Staff should be trained in the dining plan for each individual they support. This is the universal sign for choking. Call for help, use your first aid training, seek medical treatment. Your training is nearly complete. However, to ensure you take away the most important points, you will now test your knowledge with